officially reported death rates from COVID-19 are far lower than the rates reported in the US or the UK. India's low reported death rates may be due to unaccounted deaths. Over 3 million of India's annual total of 10 million deaths are not registered, and over 8 million do not have a physician-certified cause.
So in the absence of robust routine death registration, we analyzed data from 3 reliable data sources to determine how much death rates have risen during COVID. That is, how many excess deaths there were above the rates of expected deaths in a non-pandemic year. So we looked at data from India during the first viral wave, which was in fall of 2020, and the second viral wave, which was in spring of 2021. And the logic is that increases in deaths from all causes during these peak pandemic transmission periods are likely nearly all caused by COVID infection.
The first data source, called the C-Voter COVID Tracker Survey, relied on independent national polling of 140,000 adults in a representative profile of the country from March 2020 to September 2021. We asked if households had self-reported COVID deaths and compared these percentages to expected deaths from all causes.
So during the first viral peak from late September to early October 2020, about 1.2% of households reported a COVID death. And during the second viral peak from mid-April to the end of June 2021, about 3.7% of households reported a COVID death, which was more than the 3.4% of expected deaths from all causes.
We applied these proportions to total all-cause deaths to calculate an estimate of 3.2 million COVID deaths nationally, or about 29% of deaths from June 1, 2020 to July 1, 2021. Results from sub-survey of 57,000 people tracking events from June 1, 2020 to September 1, 2021 showed similar results, with overall death rates roughly doubling from April to May 2021 compared to the same months in 2019.
The second data source was the Government of India's own facility reporting, meaning reporting of deaths from all causes in about 200,000 health facilities all over the country. Now, these showed an increase of about 27% in all-cause deaths, with most of that excess occurring in April and May of 2021. During the first viral wave, the excess deaths in facilities were mostly in urban facilities. But in the second viral wave, the excess deaths were both in rural and urban facilities.
The third data source was civil registration of deaths for 10 states that had more than 10 months of observation, resulting in 26% excess deaths. Collectively, all 3 data sources consistently suggest that the true COVID death toll was 6 to 7-fold higher than India's official reports of about 440,000 COVID deaths by September 1, 2021. That would place India's COVID death rates in line with that in the US or Brazil, where death registration is far more complete.
Going forward, the Indian government could produce more direct evidence on COVID deaths by restarting its sample registration system, which is a continuous demographic study covering about 1% of the population. But given the importance of COVID, a simple solution also would be to add to the 2022 census a question on houses having any death in 2020 or 2021, and if so, the age, sex, and date of such deaths. In conclusion, our study, using 3 independent data sources, converge on an estimate of about 3 million COVID deaths in India, most of them being in 2021.